is the major determinant of what we, as a coalition dedicated to the vision of a healthier West Virginia, will fight for. And we hope that you'll be called to fight with us. So we're here tonight to talk about the bold agenda that we're pushing forward at the state level to make healthcare more accessible and more affordable for all West Virginians. And a heads up, throughout this town hall, we will be asking you to take a poll where you can weigh in on what policy ideas are most important to you. You can take the poll now online at the address shown on your screen, or if you're on the phone, please just hang tight and we will take the survey together via your phone keypad later on during this town hall. So as we're getting started, I would like to take a moment to acknowledge our hosts, West Virginia Citizen Action Education Fund, Healthcare for All, West Virginians for Affordable Healthcare, and the West Virginia Center on Budget and Policy. Once again, welcome. I'm Hunter Starks, Kanawha County Coordinator for the Healthcare for All campaign. I am part of this campaign because I believe everyone deserves access to quality healthcare, regardless of income, regardless of age, regardless of race, gender, or sexual orientation, and regardless of medical history. Everyone deserves access to healthcare. Now, I'd like to take a moment before we get rolling to stop and ponder on a few questions. I ask those of you watching online to please respond via comment as you're comfortable, and for those on the phone to just really take a moment to think about your experiences. So first, do you know anyone personally, or have you struggled with getting access to medical care? A lot of folks across West Virginia would answer yes to this question for varying reasons. In 2016, 96,000 West Virginians went without health insurance, and that doesn't even count those of us who are underinsured or who cannot afford our various healthcare payments. And if you answered yes, that you struggled with getting access to medical care, what was that experience like? What barriers to care did you face? How did it impact you, mentally, physically, and financially? What were your feelings? And given those experiences, why do you think it's important for everyone to have access to health care? I personally believe it's important for everyone to have access to health care because I believe in the power of community. Yes, I want my family to be healthy, but I want your family to be healthy too. Regardless of who you are, we all deserve access to healthcare so that we can all be stronger and healthier together. Now I'm going to hand it over to Lisa Deal, who's going to dive into the work we've done with Healthcare for All and the wins we've had expanding healthcare for all West Virginians.
Hello, everybody. This is Lisa Deal with West Virginians for Affordable Health Care, and we're very happy that you all have joined us this evening. I'm going to go over the wins that we had this past legislative session and talk a little bit about those victories. We're all very proud to be part of the Health Care for All West Virginia campaign, not just because it's important, but because we're winning. Earlier this year, we passed not one, not two, but three top priority bills on our 2020 health agenda. It was amazing to watch it all happen. People flooded the Capitol with phone calls, letters, events, and lobby visits. Personally impacted folks like you worked with legislators on both sides of the aisle to build a strong coalition around health issues. Some helped organize a bus trip to Canada to save up to 90% on insulin costs, drawing the attention to the skyrocketing drug prices here in the United States. Others hosted an ice cream social at the Capitol to remind lawmakers about the struggles of West Virginians with disabilities. And hundreds of West Virginians joined together in asking our legislators to choose people over profit when it comes to health policy. Thanks to these advocates who were people just like you, the coalition won the fight to provide dental coverage for adults who use Medicaid. When that goes into effect, it will mean that 300,000 more people in West Virginia can get dental coverage. They will be able to get preventative dental care and won't have to suffer the indignity of having their teeth pulled after it's too late. That's really a huge win for everybody in West Virginia. We also won the fight to clear the IDD waiver waiting list, which will provide home and community-based services for people with intellectual and developmental disabilities by clearing that IDD waiver wait list. Thanks to an outpouring of citizen action at the Capitol, the legislature set aside $19.8 million to support all 1,084 individuals currently on that list. And we also won the fight to reduce costs of life-saving insulin. We passed a bill to cap insulin copays at $100 for a 30-day supply. The price of insulin, which is made by only 3 manufacturers, has more than tripled since 2007. Winning a copay cap was a big step in the fight to make life-saving prescription drugs affordable for everyone. And finally, the coalition helped defeat the Medicaid work reporting requirements, which would have led to at least 37,000 West Virginians losing health care coverage. Medicaid is critically important for so many people in our state, and we need to keep defending it year after year. So we did a lot, but we're just getting started, and that's where you all come in. We really want to know what changes you would like to see to our health care system. So don't forget to take our Health Care for All poll. Here's the URL again, tinyurl.com/H4APOLL. Remember, if you take the poll now, you can win a $15 gift card. Kat is going to share some of our ideas for what to work on next. Some of these are things we'll be asking you about on the poll, so be sure to pay attention. But first, we're going to hear a personal story from Bonnie.
Good evening. My name is Bonnie Swan, and for the past 11 years, I have not had any health insurance coverage. My story begins when I turned 18. I lost my West Virginia children's health insurance through West Virginia CHIP, and since then it has been a struggle to find access to health care services when I actually was ill. I was diagnosed with Charcot-Marie-Tooth disease. It's a degenerative nerve disease, and I have a deformity in my right foot and right hip, all the way through the right leg, that has caused problems with my health over the years. I have to really pay attention to my diet and exercise and weight, and make sure that I'm not putting too much pressure on that leg to keep healthy. I've had so many different experiences with trying to get access to health care when I was ill. I've avoided going into the emergency room because of the cost and the fact that when you don't make those payments on your healthcare bills, they do end up on your credit score. So I have some bills on my credit history that won't be going anywhere for the next 7 years unless I start trying to pay them off. And I just graduated last year after 10 years working towards a degree, going, back to school, always working full time, and, it hasn't been easy to get the degree, but I'm finally getting into a professional field. And for the first time in 11 years, I'm going to have health insurance coverage. I'm looking forward to that through the state of West Virginia, the public employee insurance. I'm going to have access to get a primary care physician. I've already filled out my application. And I look forward to that. The biggest barrier for me has always been the fact that I work too much. I've always worked full-time, even while I was going to school, in restaurants, bartending, at Quaker Steak more recently before I graduated, working in the hotel industry, and working at Panera for a good stint was my first job. And the problem was I always made too much money. I always got denied for Medicaid, and eventually, there were options for health insurance coverage, but there was no way I was ever going to be able to afford the deductible for the health insurance, so it didn't seem like it was really going to benefit me. And so having the option for Medicaid buy-in would have been a great option for me as I was going to school and working full-time. I'm lucky I went to school when health insurance wasn't a mandatory thing for students because I didn't have it. I didn't have health insurance, you know. I've been blessed that I've been able to utilize HealthRight recently, and yeah, I'm so blessed to now be moving forward and having health insurance, but this is something that I hold dear in my heart, and I want more people to have access to health insurance coverage because it's hard out there, and we struggle to, you know, take care of ourselves when we're more worried about the cost of going to get health care than we are actually getting the health care to help us feel better. It's a sad day, and I just wanted to share my story with you guys. So thanks for listening.
That was absolutely powerful. These experiences are why we fight. And now we're going to hear from Kat about the policies we're fighting for to expand healthcare for all of us.
Hi, this is Kat, and my phone's ringing in the background. I apologize. I'm in my home office this evening. Let me just run over and hang it up. Excuse me. All right. Nothing like working from that home office with two phones. Again, my name's Kat Stoll, and I'm the Director of Health Policy for West Virginians for Affordable Health Care. And I think I really appreciate Hunter hosting this. Lisa, my colleague and friend, shared some of the victories that we had in 2020, and Bonnie shared her story and what many of us experienced, the struggle to be able to see the doctor without having to worry ourselves and make ourselves sick, worrying about the bills that will fall out of that visit. So I'm here to talk to you about what are we going to fight for in 2021. In January, the state legislature is going to come back in. And unlike Washington, D.C., in Charleston, our capital, you can get Republicans and Democrats to work together. Not always, but sometimes, at least more than in Washington. And I think with the COVID-19 pandemic, we'll see even more cooperation between Republicans and Democrats. And we had support from both parties for those victories that Lisa described. Slide 2, please. So the first thing that you would see in our health agenda, and it is available at healthcareforallwestvirginia.com, is an introduction. Every agenda needs an introduction. And in that, we talk about the importance of Medicaid and that our first priority in the legislature is to defend and protect Medicaid and improve it. You may not know, but 1/3 of us in West Virginia rely on Medicaid. That includes seniors who are dual eligibles. It includes children. And the program is funded with federal and state money. There's a very high match of federal money, so it also is good for our economy. Slide 3, please. The introduction also talks about how important the Affordable Care Act has been for our state. And the most important thing that I think of with the Affordable Care Act is that more than any other state, we're ranked number 1 in the reduction of uninsured people that we had after the passage of the Affordable Care Act. We had the largest, hang on one second, my phone's getting ready to ring again. Well, certainly has been a dynamic presentation so far because I've been running up and down to my phone. But anyway, the Affordable Care Act is, in West Virginia, we had the largest reduction in uninsured of any state in our nation. And partly that's because we expanded Medicaid. Not every state has done that. And we expanded it to 150,000 of us. So that allows people who work part-time or very low-wage job, no health insurance benefits, to actually be on Medicaid because they don't have any other way to have insurance. So thinking about that, slide 4, please. You can see our introduction first states that we oppose any efforts to cut Medicaid by the state legislature and that we oppose any efforts to repeal the Affordable Care Act. And that actually I want to talk about for just a second. This is a little commercial break in my presentation about our state health agenda. You may not know, but there's a case before this U.S. Supreme Court, and the filings were just this past week, and we saw that the federal government and President Trump are asking to completely repeal the Affordable Care Act. And there's a bunch of issues going on in the case I won't elaborate on, but they are really quite frivolous. They are silly. But the important thing for you all is that our West Virginia Attorney General, Patrick Morrisey, signed West Virginia onto this lawsuit to completely wipe out and repeal the Affordable Care Act. And that's problematic. We are talking about hundreds of thousands of people having access to health insurance who never had it before. So I hope that you will go to healthcareforallwv.com. And by the way, that's all one word, lowercase, healthcareforallwv.com, and sign our petition asking Attorney General Patrick Morrisey to take us off this lawsuit. And it's just crazy what it would mean in the course of the COVID pandemic to be on a lawsuit that would take health insurance away from so many of us here in West Virginia. Okay, if we can go to slide 5, please. So I've told you a little bit about the introduction and how part of our work is to be in a defensive posture, but that's not very satisfying. We actually want to move things forward and expand coverage for people and different benefits and different eligibility. So we've laid out 7 legislative goals that we think make sense for 2021. And I'm going to run through those fairly quickly, but I hope you'll pay attention because there's a test at the end of this PowerPoint. It's also our poll, and I'll be asking each of you, whether you're on the phone or joining us by Facebook, to have some fun and vote on these. You're going to get to rank them and how important you think they are. So let's go through the agenda. Next slide, please. So the first item on our agenda is to create a children's health insurance choice program to close children's coverage gaps. You may not realize it, but there's still a lot of kids in West Virginia who don't have access to health insurance. They can't go to the doctor when they get sick unless their parents handle very large bills. We can help this problem by allowing families who are above Medicaid and our children's health insurance program eligibility levels. You know, they make just a little too much income, but they're still not in a job that has health insurance. We can let them buy into the Children's Health Insurance Program, or CHIP. It doesn't cost the state money, but it gives people a new, cheaper, very excellent source of coverage for their kids. So that's item 1. Next slide, please. The second item in our agenda is to create a Medicaid buy-in program. And really what this is, for those of you who have heard the term, is a public option on the Affordable Care Act marketplace. It would be an option, another choice of health insurance that you could purchase using your premium tax credits or subsidies. And it would look like Medicaid, very comprehensive coverage with very, very low cost sharing, and you would have really a new choice. And the private insurers would have to compete with that new choice. You would get to choose it or not. It would be up to you. So it's really a way to add competition and additional choice to the Affordable Care Act marketplace in our state. Next slide. And the third goal of our agenda is to expand Medicaid coverage to 1 year postpartum for women up to 300% of the poverty level. So you can see on the slide there, 300% is about $37,000 a year for a single mom. A lot of folks at that income level really don't have affordable sources of insurance. What we want to do in this past, the year before last, we passed a bill to provide 2 months of postpartum coverage after the baby is born for the women at these income levels. What we'd like to do is expand that to a full year, or maybe even 2 years. I'd really like to see us push for 2 years, so that a woman who is in a substance use disorder treatment program, who has postpartum diabetes, maybe postpartum depression, can still see the doctor for a year after the baby's born. So she can keep herself healthy And that way she can take care of the baby better, and it's a better way to start a healthy family. Our fourth goal that we've set out is, next slide please, is expand the vision care benefit for Medicaid enrolled adults. Lisa told you that last year we got dental coverage for adults so that they can get a regular dental exam, get their teeth cleaned, etc. We also want to expand the vision care benefit for adults. Kids on Medicaid get dental and vision care, but adults don't. And basically, this is common sense. If we get adults on Medicaid eye exams and glasses, they're going to have a better time doing a job interview, keeping a job, doing well at a job, and also at parenting, particularly with COVID-19. All of us are teachers now. We're at home with our kids filling in. But that's hard to do if you need a new pair of glasses and can't afford them, and they can be very expensive. So this doesn't cost the state a lot, but it's a common sense goal to allow folks on Medicaid, adults, to get their teeth fixed and to have the eyeglasses and the eye exams they need. I like to say that you're going to do better at work and better in life if you can smile with confidence and see with confidence. Next slide. Our fifth goal, regulate high prescription drug prices. And obviously this is going to save money in our public employees insurance program and Medicaid and for everyone in the state. In 2020, this past legislative session, we passed a bill that provides provisions for transparency about how prescription drugs are priced. We want to build on that. That public information will start being available in July. And we want to create what's called an affordability board. It's similar to one that's been created in the state of Maryland and in several other states across the country. And it allows us to look at why prescription drug prices are going up, what's driving that, and when is it inappropriate. Right now, no one regulates prescription drug prices in this country for the most part. We're just beginning to look at insulin, but insulin isn't the only expensive drug. So this will create an affordability board that will help look at how we can lower prescription drug prices. And just think about this. 1 out of 4 Americans, with insurance or without, report that they didn't fill a prescription drug in the past year because they could not afford it. And I can certainly understand that myself. So next slide is item 6. There's only 7, so I'm almost through this. The 6th one is to enact paid sick and medical leave and paid family leave for West Virginia workers. It is unreasonable that as a parent or a caregiver for your elderly parents or grandparents that you have to choose between keeping your job, getting a paycheck, or taking a day off to care for that child or elder person in your life. So this is something other states are starting to do. We have some laws at the federal level, but what we really need is paid sick and medical leave and paid family leave. And you may say, well, small business can't do that. Well, in fact, we've seen from the research and the polling that small business thinks this would be great. They would like to do this. They need a little help, and there's some financing issues in this, but it's really so important. And if you think about COVID-19 and what it's taught us about the need to stay home when you don't feel well, it's really just a very important goal, and I think a really exciting one. And our last, next slide please, our last but not least goal is to improve how Medicaid addresses non-medical factors that influence your health. Okay, they call these social determinants of health. These are things like housing, transportation, food, education, stuff that isn't strictly medical. They can really determine whether you are healthy or whether you can recover from a health condition that you have. So we're not thinking real big here, but as a first step, we want to create a public-private task force to look at ways that Medicaid can pay for things like housing and food supplements. In our managed care, Medicaid managed care organizations, the folks that that deliver Medicaid services, they're starting to do this. But we really say it's got to be more than just referring people to another source of possible housing help. We want Medicaid to be able to pay for the things that help control how your health will turn out. Will you be able to recover? Will you be able to stay healthy? Now, I promised you when I got through all 7 that we do a poll and you get to rate each one of these. But I get to do a couple quick commercials before we get to the poll. Next slide, please. As you can see, the slide says key to moving forward in West Virginia. And really, we have ambitions and goals for West Virginia for 2021 and looking forward. And none of these things will be possible if the federal government does not pass another COVID-19 fiscal relief package. You may know that the House passed one. It's called the HEROES Act. We need the Senate to get on board with passing a federal fiscal relief package. You can call it CARES 2, you can call it CARES 4, but it needs to include extra money for Medicaid and extra funds for the states to fill in the shortfall that we're seeing in declining revenues because of our high unemployment rate. We need you, we really need you to call Senators Manchin and Capito, because this is a Senate game. The House passed a package, and ask them to support a package with an increase in Medicaid and additional funds for the states. You can go to bit.ly, so bit.ly/WV COVID response. And there you can get some more information and a link to contact Senators Manchin and Capito. If somebody can put that up on Facebook, I'll repeat it again. It's bit.ly/WV COVID response, WV COVID response. Help us, if you don't remember that link, just look them up on Google, Manchin and Capito. You can call them, you can go to their Twitter accounts, you can go to their Facebook accounts. They monitor all that stuff, and tell them we need another package of federal fiscal relief. We won't get anything done in West Virginia but fight off cuts to Medicaid. Now I get to do one more commercial. If you can go to the slide that says stories. I can't see the slide, so I hope we're tracking along nicely. You heard Bonnie's story. Every single one of us has a story. I have health insurance, but I consider it I'm underinsured. I could tell you my stories about struggling to pay for some pretty serious eye problems that I had. Everyone has a story. The most important tool, the single most important tool to change policy is real people's stories. I can write reports, I can generate data. It makes no difference like a story does. So if you have a story, you can share it. You can share it anonymously. You can share it with every legislator in Charleston. You can share it with the media. We'll help you figure out what you're comfortable with. You control your story, but if you help us by sharing it, you will help yourself and others improve health care in the state. So that's my pitch for stories. You can see there's a www.surveymonkey.com, and then it has this /R/BV5J3SN. Oh, that's a mouthful. At the end of the slide, you'll see my email. You can just send me an email if you like, if you can't get that link. I know some of you are here joining us by phone, so that's a lot to remember. Okay, so now before I go to my thank you slide, I want to have some fun and do this interactive poll. I think I'll walk you through how to do it because I'm not sure if we have a slide with these instructions on it. So you're going to vote on each one of those 7 items in our health agenda that I just described. But we mixed up the order a little bit. So we just want to make sure you're listening carefully. We don't want to trip you up. It's really important that we know what's your highest priority because we have to decide which of those 7 items we make our top priority. The order I gave them to you in is not necessarily the order that we'll fight for them in. And remember, if you enter our poll, if you participate, you're entered in a raffle drawing for a $15 gift card. Woohoo! $15 gift card. Yes. So I don't get to play, but you do. So here's how it works. If you're on the phone, you can use your keypad to enter your response 1 to 5 when prompted. 1 is the least important, and 5 is the most important. I just think bigger is better. Bigger is most important. Bigger is better. You can also take this poll, and I think you can see this if you're on Facebook, by visiting tinyurl.com/H4A poll. tinyurl.com/H4, the number 4A. So H number 4A poll.com. You can leave a response on your Facebook live stream if you want. We will be looking at all of those. So, okay. 1 least important, 5 is most important, bigger is better. Let's go through the questions. So question 1, how would you rate the importance of enacting a paid family and sick leave in West Virginia? 5 is most important. And I told you I'd mix them up. That was the second to the last, and now it's the first. Okay, let's do the next one. How would you rate 1 to 5 the importance of regulating high prescription drug prices? 1 being the least, 5 being the most important. Regulating prescription drug prices, and yes, we can do it at the state level. Okay, next one. How would you rate the importance of expanding Medicaid to cover moms for 1 or 2 full years after birth if they earn less than 300% of the federal poverty level? You saw that on the slide. So this is coverage for moms after they give birth for 1 year. How would you rate that? 1 to 5. Next one, how would you rate the importance of creating an affordable Medicaid buy-in or public plan option on the Affordable Care Act marketplace? That's for families who make too much to qualify for Medicaid. So this is a way they would be able to use a premium subsidy or tax credit to buy into Medicaid, probably at a good price and more comprehensive than other options, and it'll be a source of competition on our marketplace. Okay, so Medicaid buy-in public plan option 1 to 5. Bigger is better, 5 is most important. Okay, we're going to tool through these. How would you rate the importance of creating an affordable CHIP buy-in option for families with children who are uninsured but don't qualify for Medicaid or CHIP? It's a lot like the previous one, except this is a CHIP buy-in option for kids who aren't eligible for any public programs. So it would be a type of health insurance that you would pay into. You would have to pay a premium, but you would get that great CHIP coverage, and it would probably be less expensive than any other options. 1 to 5. And the next one is the importance of expanding vision benefits for Medicaid-enrolled adults so they can get eye exams, glasses, and other routine vision services. How would you rate expanding vision benefits for adults in Medicaid? 1 to 5. Bigger is better. 5 is most important. And I hope you're having some fun with this. It really does help us to hear how people feel about this. Don't just give them all 5s. If you did, we'll forgive you. But next one and last, again, you can use your phone keypad to go to that tiny URL address, or you can just do it in the comments on Facebook. How would you rate the importance of using Medicaid money to pay for housing, food, education, all those things that impact our health that are non-medical, so that we are looking at a person in a holistic way? So social determinants of health by another name, but it's really using Medicaid to help. For example, if your child has asthma and you don't have air conditioning, that child's on Medicaid, we'll buy them an air conditioner and they won't have to go to the emergency room 5 times over the course of the summer because they'll have filtered air in their bedroom and maybe in the house. That'd just be one example. So how would you rate that, moving in that direction with the Medicaid program, 1 to 5, 5 most important? Whew. That's a list of questions, but I'm done, and I'm going to turn it back over to Hunter. I want to thank everyone for listening to me babble on about our agenda, and we can't pass any of this without your help, your involvement, your stories, your phone calls, your visits to the state capitol. So please be safe, be healthy, and please join the Healthcare for All West Virginia campaign. Thank you.
Hi, thank you for taking the time out of your day to hear more about the Healthcare for All campaign. I hope you can leave here today with some perspective on the problems we're facing here in West Virginia, as well as some solutions to making West Virginia a healthier place for all of us to live. So before I close, I'd just like to share with you all what brought me here today. So I'm a single parent to the absolute brightest 3-year-old you will ever meet. So for the majority of her 3 years, we've been low income, and I've been on Medicaid. I recently made the decision, hey, I'm going to get a second job. I'm going to try to get my family out of poverty. I'm going to do this thing. And I'm losing my Medicaid because of it. And that's terrifying. But, I am not the kind of person who can sit idly by while outside forces negatively affect my livelihood. I know that some of you on this call feel the same way, and together we have the power to change things and improve life for all of us. So I really hope you're called to join us in this fight and tell us about your healthcare stories, because we need to hear them. We need to hear from you. And if you're interested in joining our movement, please visit our website at healthcareforallwv.com/join. You should be able to see that on our screen. And that's it. Thank you all again for joining us on this Monday evening, and I hope you all have the best week, and goodbye, everybody.